Well, good evening, and thank you for joining us on our first Google Hangout. Tonight, we have brought together a group of women to discuss health and youth. My name is Belinda Berrigan, and I'm here with my colleague Diana Amaya, and we are with HOPE, which stands for Hispanas Organized for Political Equality. And we are a not-for-profit, nonpartisan organization that is committed to ensuring political and economic parity for Latinas through leadership, advocacy, and education to benefit all communities in the status of women. So both of us work for the Hope Leadership Institute, which is an intensive 9-month training program for professional Latinas that includes personal skill building and information on maneuvering in the local, state, and federal political processes. This program brings together Latinas from across the state, representing diverse geographic and professional sectors. And so what brings us here today is for the past 3 years, our Hope Leadership women have been doing work in their communities to ensure that Latinas and their families are signed up for the Affordable Care Act. And in our outreach efforts, we found that many of the youth weren't engaged in this discussion and did not know very much about the Affordable Care Act. So today we brought together Melina Duarte from Coachella, Chelsea Esquivias from Bakersfield, Cindy Lopez from San Jose, and Yamilet Rodriguez from Fresno. And so we wanted to share perspectives of these different regions with you about how to engage youth in what is very important, healthcare and the Affordable Care Act, and making sure that our youth are involved throughout the process. So why don't we go ahead and get started, and we will start with Yami. Yami, because of your role with let's have you introduce yourself first. Forgive me. Let's go down and let's start with Yamilet. If you can introduce yourself, what you do.
Sure. Yes, Yamilet Rodriguez. I'm Director of Programs for our Central Valley office here in Fresno for Youth Leadership Institute.
Thank you. Okay, the next, Melina, if you could introduce yourself, please.
Sure. My name is Melina Duarte. I work in downtown Oakland for the University of California Office of the President, which is the headquarter office for the UCs, and I run a math and science program for high school students called Cosmos.
Thank you. And Cindy, if you could introduce yourself, where you're from, what school you go to.
Okay, I'm Cindy Lopez. I attend Andrew Hill High School. I'm a senior at Andrew Hill High School. I'm from San Jose, and I also attended the Hope Youth Leadership Program.
Perfect. Thank you. Chelsea, if you could introduce yourself, please.
Hi, my name is Chelsea Esquivias, and I work for Goodwill Industries. I oversee public relations and community partnerships for the South Central portion of California. I'm also in school for my doctorate currently, and I teach at one of the local colleges.
Perfect. Thank you, Chelsea. And thank you, ladies, for taking time out of your busy schedules to join us. But if we can start with you, Yami, I know that you have another engagement.
Sure.
And we want to make sure, because of your role with the Youth Leadership Institute, how do you think it is in the best way, how do you communicate with youth to make sure that they're engaged and informed in something such as important as healthcare?
Sure. I think for us, part of the work that we do here at Youth Leadership Institute is to empower young people to have voice at the table, whatever issue that may be. But it's creating opportunities for them to be seen and heard as resources and as current leaders in our community. So one of those things that we've addressed most definitely is the issue of health. We've had young people be able to really express, their concerns about not having insurance, not having access to healthy food, especially in our rural communities. In Fresno County alone, we have 14 food deserts, which is definitely an outrage because we are in one of the food capitals of the world, but yet we have people who are suffering from not having access to healthy food. So part of that process is really to be able to engage young people in those conversations is to see how it impacts them directly. Through the Hope Youth Program that we now are able to administer here in Fresno, the young people surveyed their very own classmates, and they wanted to see how they felt about it, and did they have access to insurance, and did they even know if they had insurance or not. And a lot of the answers were either I don't know or no. So just being able to compile that information, talk to their peers one-on-one, was a real eye-opener for the young people. They were able to see data from their own schools, and one of the other main questions was, do you have access to healthy food? Can you walk to a grocery store that has healthy food options? And many times the answer was no. So as part of that, we've had several young people who have decided that they want to do active campaigns in their communities to address that issue of access to healthy food. And one of those main things is to really look at our corner stores who are in our communities and see, would they be willing to be more community friendly? Would they be willing to be more family friendly? And would they sell fresh fruits and vegetables to give those opportunities for our community members? And really bring about the wellness of the whole person, which would be preventative care, really being able to eat those healthy fruits and vegetables so that we don't deal with this issue of diabetes and obesity that we so strongly suffer here in the Fresno area. So it's active young people on the ground in the field, but making sure that it's the whole cycle of the learning process for a young person, getting the data that is needed to see what is the issue, then planning and implementing a campaign that is truly youth-led. This was something that the young people wanted to do, and so we're on that plight right now. We're on that plight to working with our corner store owners in our most impoverished communities here in Fresno.
So what do you think, Yummy, is the best way to engage youth? How do you get them excited about this? What are some of the ways that you keep them engaged or even to understand and share that with their peers?
Right. Engagement of young people, you really specifically have to connect with them directly as far as what is impacting them. What are the issues that are impacting them? I think it's if we continue to be very activity-based in our communities and programs-based, we will not engage youth. Young people need to see from the beginning to the end why issues impact them and what can happen because of these issues. So it's truly a youth development process. If I just connect with young people and just have activities for them to, I'll give you an example. So say, for instance, we just have a big event at a club somewhere, Boys and Girls Club, just for example. We have a big event and we invite everyone to come. But if there truly isn't any action or impact that takes place, what really did we do to impact that community? So I think we really need to get away from an activities-based type of programs that we do and talk to our young people to say, hey, what can we do to create true sustainable change in our communities and make impact? So it's that whole youth development process to see the young person as not as a token anymore, but to really see as young people as resources and have them there at the table helping us make decisions for healthier communities.
Perfect. Thank you, Yummy. And I think you hit it. They're no longer tokens, and I think we have a great leader in somebody like Cindy Lopez, who's here also with us. And Cindy is currently, or I should say, just graduated from the Hope Youth Leadership Program, and she's from the San Jose area. And Yummy is one of our advisors that takes the Fresno group for the youth. But Cindy, let me ask you a question. What do you see as one of the major health concerns in San Jose?
So from our surveys and asking a lot of the girls and the students at our high school, one of the major health concerns was definitely obesity and unsafe sex. Along with that, transportation is also one, because a lot of them worry about how to get to their health center. And with having the health clinic, the transportation, you didn't have to worry about it. And another health concern was definitely smoking and teen pregnancy.
Okay. Cindy, why don't you explain to them why your school is different and how you have a school health-based center on campus and how that serves your friends, you, and the community around it.
Okay, so our school does have a health clinic, and it really does correspond with our high school because our high school correlates along with the nurses, and a lot of the teachers, if they see if there's a problem along with the student, they will directly they would directly find a way to send you to the nurse, and in some way they would have counseling, which is a direct way of like encouragement. And a lot of the students who didn't find the health clinic successful or they didn't find it useful, I found that they already had another health facility that they could go to easier, and they weren't low income. So a lot of the ones that did find the health clinic a lot more helpful were low income families or undocumented students.
Mm-hmm.
And this is very beneficial to our community because one, it's local and it's right there. Like a lot of the students, they don't like telling their parents, they don't want to tell them about getting like birth control or all these things. So going to the health center is very confidential, and they give you a secure environment, and they're also very open to everyone. And a lot of the things that you go to them, they keep it confidential, and they have many benefits. So there's from taking tests to birth tests to taking your physical to teaching you ways of contraception, abstinence, and as well as they even have a local dentist. So having a health clinic is super beneficial. And I even had one of my friends who doesn't have a health clinic at our school, and they're very like 10 minutes apart. She's telling me that and she had actually went to our school, Andrew Hill. She said that she had seen way more girls who are pregnant at her school than at Andrew Hill. And that's because our health clinic does provide workshops that aware students of teen pregnancy, and they also have workshops that show consequences of being pregnant and workshops of safe sex, so protection.
Okay, thank you, Cindy. And Yummy, and being true to what, we just have one question for you.
Sure.
Yeah, so the question is, given that Cindy just kind of outlined some of the major concerns that she has, that young people in San Jose have, in your experience, what are some of the other concerns that young people in Fresno have, aside from what you mentioned in the desert?
As far as health concerns themselves, well, I think there's a major issue, even in our own community, where our healthcare is being limited on the county level to our immigrant families, and that's a major issue right now that is being on the forefront in front of our Board of Supervisors. And when young people are aware of issues like that face their families directly, it becomes really concerning to them, and they want to be a part of the process. And I think I go back to, we as adults need to be intentional to include young people as a part of that process and to value them and value their input. And so I think if we create those opportunities and make sure that we make them aware of things that are happening, they want to be at those forefronts. And so yeah, there's definitely the issue of immigrant healthcare. There is the issue of access to healthy food. There's the issue of just access to healthcare in general. I mean, we have a huge undocumented population here in Fresno, and it's a major issue.
Okay, Yummy, thank you for your time, and I know
Yes.
that you have another commitment.
Thank you for having me. Bye.
So Cindy, back to you in hearing what some of the hearing some of your comments. You said that the health center also serves the community. What do they do to serve the community? How do you see that it's being used by the community?
Say that again?
So you said that the health center that you have on campus serves the community. What are some of the activities, or how do you see that the center serves the community?
Okay, so they have a local dentist, and they have a family dentist, a family doctor, and it's a health clinic they work, so if you want professional health care, they'll give it to you immediately. it's also they don't care about your they don't care if you're undocumented. So it's open for all. And as well as that, it's very local and it's very affordable. As in, if you're a high school student, it will not cost you anything. And I'm not sure about families, but I do know that a lot of my friends who have parents who are undocumented, or like my parents, they actually just go there for like $20 for like a scan for their teeth, and it's really affordable, and they don't ask for like ID and such. So.
Okay. Did they put on any like health fairs or anything like that?
Yeah. Actually, we have like 2 annual health fairs at our school that correlates along with the along with the health clinic. So, and the health fair does have a lot of, they have several dentists come, and they have several doctors come and test them with like TB shots, and like, it's definitely open for all, and that's when you see a lot of San Jose come to our school just for the healthcare. And that's why you can see that every school should have one, because if the entire San Jose is coming to our school for it, then it's really valuable.
Yeah, so there's a major need, and we heard that too. And I think what's important is that you, through your school, get to see the importance of a hospital, a healthcare center, or any of these things that our community needs, especially for the undocumented, which were left out, in the Affordable Care Act. So Melina, with that, you're one of the current Hope Leadership Institute participants. And one of the things that was one of your assignments was doing a healthcare roundtable with you. Can you explain to us a little bit about what you learned and how they felt about healthcare, and what were some of the concerns and issues they brought up?
Sure. So we had an event in Los Angeles, and so we had these youth that joined us for a session. So the youth that were there were students from Orange County, Costa Mesa area, the Fresno area, the Bakersfield area, and the LA area. And so it was interesting to hear the conversations that they brought to the table. When we talked about healthcare, most of them didn't have primary doctors, and they said that they received their healthcare from their school services. So none of the schools that were there with us had a school-based health center, but they did have services that would come to their school. So for example, as Cindy mentioned, there were doctors or dentists or folks doing vision tests that come to the school maybe once a year, twice a year. And so it seemed that that's where most of the students got their primary care services from. Some of the students at the table had mixed families, so maybe they had been born here, but their parents hadn't been born here. So they said that was one of the reasons that they didn't really have primary care doctors outside. Some of them said their parents just couldn't take the day off, so whatever services came to the school is what they received. For most of them, the teen pregnancy was an issue, and they wished that they had more of those services on campus so that they could feel more comfortable talking to somebody at their campuses to talk about birth control or provide birth control. But at the moment, because they don't have a school-based health center, they don't really have anything like that. So those were their big concerns. They weren't really concerned for proactive healthcare. It was more, this is what's happening, and I need something to help that now. So it was a very mixed, because they did come from different areas, and I think the students from Costa Mesa were the ones that didn't have health services at their schools, like some of the students coming from the rural areas. So the students coming from Fresno and Bakersfield were coming from more rural areas where there are migrant populations, and so these outside third-party care providers come in. But the students in Costa Mesa didn't really get that, because they are in more of an urban area, and there are other clinics outside of that.
And then, Melina, so who was in your group? How did these youth interact at that table? Who were some of the folks that were there?
So it was a good mix of students. So it was interesting to hear from them the conversations. If one student said, oh yeah, we have a nurse at our campus, the other one would say, oh, we don't have a nurse. We've never had a nurse. It's just the lady at the receptionist that helps us if we have a headache, or we come in and she lets us lay down if we don't feel good. And So it was really interesting to hear the inner city versus urban. We also had a group of boys that were at the table, of young men that were at the table with us, and those young men brought in a different perspective. So the girls were talking about the birth control, and the guys didn't even have a clue. They didn't know if their school offered anything. They weren't even knowledgeable as to what was offered at their school. And those students, the young man actually came from a very inner city LA school close to USC in South Central LA, and they didn't know about any of that stuff. So I think the girls had it more on their mind than the boys did. The boys really didn't worry about the health care.
Alina, what was the difference in the health concerns between, you mentioned, the students that came from rural areas and the students that came from more urban inner city areas?
I think that the students that came from the urban areas had more health centers around them, and there was other places they could go to. The kids from the urban schools, the rural areas, they didn't. For them, it would have been really a drive to get to somewhere. And because I think of the demographics in those rural areas, the culture of healthcare is very different. So nobody takes time off of work to go to the dentist or to go to the doctor. You don't pull kids out to do routine health visits. I think the kids from the rural area, because one location, there are more facilities near them, or depending on their family's immigration status, they have access to that, and the kids in the rural areas really don't. So they only know what they've seen at their school.
Cindy, what about you? Melina mentioned the different health concerns between boys and girls that she's, that joined her in this healthcare roundtable. What do you think are the differences in health concerns in your school between boys and the health concerns of girls?
So Melina had mentioned that teen pregnancy was one of the big ones. Teen pregnancy it's a little big, but it's not as big as I believe in the rural areas, because we do have workshops, and we do have a lot of the nurses do come, and actually a lot of teachers, if they see that you have problems, they actually go ahead and they write you a slip to go talk to the nurse, and then they will provide you counseling, and you have someone to talk to. So that was something different. And something else that was different was, I guess, transportation, because it is a lot easier to get to your local health clinic than you say in Fresno or in Costa Mesa. And something else would definitely be well, it's a lot more open to the community. Like, a lot of everyone's more aware of this, because you could say that it's more announced, the health clinic. You have it more announced than you would say at the school, and it's open like 5 days a week than it is like once a week, and we have a lot more staff in the health clinic than a nurse.
Okay. All right, thank you. Chelsea, which brings us to you. You have done some surveying of your community, which is Bakersfield. Tell us a little bit about your findings and what is going on in Bakersfield, and then how are the youth in Bakersfield, and how do they understand healthcare?
Okay, so in Bakersfield, can you hear me okay?
Yes, we can hear you.
Okay, so some of the issues that we are having in Bakersfield, when you look at our statistics, is that 40% of those eligible for healthcare through ACA are adults, are not accessing it, and they're not enrolled, they haven't applied. So we have 40% of the people who can apply not applying. Not to mention the number of undocumented in our area is extremely high. In Bakersfield and the surrounding areas, yes. So South Kern County having such a high rate is really disheartening when you look at what kind of a lot of community partners and organizations, and when I say a lot, I say all the ones who do things with healthcare, have been going out and meeting with the community and getting children enrolled. We're getting the children enrolled, and through that education and through that funding, we only have 1% of the children in South Kern County not covered that are eligible to be covered. So what that means is what we found is when we dump money or we spend money, we dump is wrong, but when we spend money on education with community-based organizations going out and educating all of these people face-to-face is working. They were doing that, they've been doing that for the children, and here we are now with only 1% not covered. Whereas when you look at the adults, so at the 40%, there's a lot of work to be done. The issue now is that they're covered, but what does that mean? So I started speaking to some of the students when we were doing roundtables. When I came back, I've spoken to some of the interns that have worked for me, and they really don't know, what I found personally, they don't know what it means to be covered. They don't know how to access it, they don't know how to find the health care, they just know that they're enrolled. And so in looking at that, we've accomplished a huge goal in getting them enrolled. As but if they can't access it and they can't use it, what does that mean? And when you look at the statistic, like 40% of adults in South Kern County that are eligible are not enrolled. When you start adding in those that are undocumented, that is a huge number of people in our area that aren't accessing the healthcare coverage unless it's a dire need. So they're not going for any kind of preventative services. They're not going when they have a small problem. They're not going to the doctor because they can't, or they feel that they can't. And when you look a little bit deeper, they aren't going until something is really, really bad. Something is wrong with them, and they have a huge issue.
Right, and we've heard that throughout with all the outreach and efforts that the last 3 classes have done, meaning through, from the Hope Leadership Institute. And Melina, I know that you and I were talking the other day, and there's some big things going on in Coachella, which is where you're from. And Chelsea says that, there's so many uninsured and so many that still need to be serviced, which again, were left out of the Affordable Care Act. So what are some of the things that you're doing in Coachella that kind of try to offset that?
Yeah, so I'm actually originally from Coachella, the city itself, and so I'm very well connected still with the city and everything that they're doing. So a few of the things, I think that Cindy mentioned, her school-based health center has the twice-a-year health fair. So those things are also happening in the eastern Coachella Valley. The population there is also a big part is migrants. So there are families that are coming and going throughout the year, and they probably migrate up north to the Fresno and Bakersfield area. But so what's happening is there's 2 organizations, the Flying Doctors and the Doctors Without Borders, which are volunteer doctors, currently volunteering, doctors that have licenses that volunteer, and they usually do these in third world countries where they'll set up a day, they'll go to a country, they'll all fly in, and they'll just do a whole day worth of services for folks, vision, dental, medical, a lot of outpatient surgery type things. And so they've picked the Coachella Valley to also do this. So they usually don't do these in the U.S. They do them outside, but because there is such a large need of mixed families or undocumented folks or uninsured folks, they have set up shop twice a year. So the 2 groups do 2 separate ones. And because there is still such a large need, and people are lining up outside the doors for hours and hours, and this usually happens in the summer, and it's about 110 to 15 degrees outside, but folks really need these medical services. So as a response to that, they built a center that's called the Volunteers in Medicine, and it's a very similar situation, but this is funded through the county and through private and public service foundations. And so they also are using these retired doctors or volunteer doctors, but they do have to have current licenses to practice medicine. And so they set up shop at this center, and we found that there are a lot of seasonal workers that are coming through that. So there are migrant workers that go with the crops, and then there are also seasonal workers in the Coachella Valley. So the Coachella Valley is very known for all of the resorts and the golf courses, and so all of those places, they employ gardeners and housekeeping, all the hospitality and kind of service industries. But during the summer, it's 120 degrees, so folks aren't going out there on vacation. So those resorts and organizations, they run on skeletal employees in the summer, and so all of those workers are then unemployed, and so they don't qualify for their health insurance for a couple months a year. So they are seeing a lot of those folks coming through these different health fairs because they have health insurance for a couple years out of the month, but not the full 12 months. So they've really done a lot, and with the California Endowment and the Building Healthy Communities, they've been able to leverage a lot of the services that they have to offer. So it's no longer just these twice-a-year health fairs. They're really trying to stretch it out so that they have continuous health services. And again, it doesn't mean that folks are going to them for preventative medicine, but at least they can go to somebody for more than once or twice a year. One of the health clinics, it's federally funded, but it's actually behind Coachella Valley High School. So it's not on the campus, but they set up shop right behind. The problem with that one is that it is federally funded, so students can only go if they are born in the United States. So if their immigration status is that they're a resident or a citizen, but at least they have something. And again, going back to that mixed families, when a parent is undocumented, I mean, I don't know the statistics, but it's highly unlikely they're going to take their son or daughter to a medical center. So having those services near the campus is easier for the student to go to themselves, and they can get the services they need.
Awesome, and I think something like that should be duplicated, and I think it's something for our women to do more research on, is really trying to figure out how that works, how that can be, duplicated in other communities. I mean, especially for those that aren't as lucky as Cindy with, school-based on campus. So, Chelsea, in your research in working with the youth in Bakersfield, was there anything that was alarming to you or that stuck out? Yeah, so during your work with Bakersfield and the youth, was there anything that stuck out to you that was alarming or that kind of caught you by surprise?
Yeah, there's a lot of alarming statistics in Bakersfield and in Kerr County. One of the strongest statistics that I think really proves the need for education and the need for our youth to understand how to use their health care coverage, especially with the lack of school-based health centers in our area, is our pregnancy rate. Our pregnancy rate is around 60% right now in our area, and so with such a high pregnancy rate, we really need to make sure that we're focused on educating not just our girls, but our girls and our boys. We need to make sure that our youth and as a whole is educated.
That's true, Chelsea, that's true. So I'm going to turn it over to Diana. I know she has a couple questions that came in, so.
Yes, Cindy, so someone wants to know, what was your awareness and healthcare needs for yourself prior to joining HYLP?
What was my what?
Your awareness and healthcare needs for yourself and for your community before doing the Hope Youth Leadership Program.
Oh, so before the Hope Youth Leadership Program, I didn't really know anything about my health clinic, and I didn't know how important it was until this program, because I got to talk to all these girls, and they would tell me like, oh, we don't even have that, or we don't even have this, or like, to get to this place it takes me 10 minutes, and I'm like, oh wow, that's so far, like it only takes me like a minute walking or something. And yeah, I didn't after the program I realized how important that is. I mean, my health clinic. And I mean, some of the girls, I heard that they have some programs like I believe it was Orange County has a program of preventing pregnancy, or I think a clinic right there, a school where you could actually leave your child or something.
Daycare.
But, yeah, we got to kind of differentiate our programs and stuff. And there are some schools without no programs, and none of them had any clue about from what they told me on their surveys, and none of them had any clue that their schools had that a lot of the students didn't know about medical insurance or about the medical reform or about Obamacare. And then we saw that on our survey, a lot of the students, because of the health clinic, well, we think because of the health clinic that they're more aware of their medical insurance and about Obamacare, because our health clinic in a way does teach us, and they do have like workshops in a way that does kind of inform us about information that schools without health clinics wouldn't give them. And the Hope Youth Leadership Institute program, it really has showed me that, well, my school is pretty lucky because we're one of the few schools with the health clinic, and that's also because of the lack of money, right? Like the budget cuts. And now a lot of the girls from the San Jose, we really do want to go ahead and start making the health clinic bigger than it was, because there's some students that still, they don't use the services at the health clinic. And then when we did survey them, they didn't find the health clinic so valuable or so helpful. And if they did go there more often, then I'm pretty sure they would find it a lot more helpful. And what I found through the Hope Youth Leadership Program was that the ones that are seeking the services at the health clinic, the ones that go there often, it correlates with their health and appearance, and a lot of them are a lot more happier, and they're more involved in sports because you have someone to talk to, and the ladies, they do give counseling, and this, from the surveys, this shows that they're a lot more happier with themselves.
Right on. Chelsea, a question for you. The Central Valley, in particular Bakersfield and Fresno, were very important for California to do outreach and to get people to sign up, and they actually even enlisted the help of Dolores Cuerda, a icon in our community. What else do you think, or what other strategies do you think will work in outreaching to those 40% of eligible folks that haven't yet, signed up for healthcare?
I think that Dolores Cuerda has been phenomenal. I think that she has some amazing organizers and some people working with her, and I think she's on the right path. And when I'm speaking to people in the community about this, they also have really great things to say about her. I just don't think that it's at the level that it needs to be done. We need 5 more Dolores Cuerdas in our community. 5 times the people out there speaking to the people in our community. What she's doing is wonderful, but it's not enough. And it's no fault of hers. Is that we need more money funneling into this area and more organizers and more people out there having those community parades and community sign-ups and all those things that people can go up and we can speak to someone face-to-face and have a discussion and learn how to use and how to enroll in their healthcare coverage.
Awesome. Melina.
Yes.
Chelsea's hitting on something about getting more people, more leaders in the community involved. And in our conversation, in past conversations, you mentioned that Congressman Ruiz, who is actually a doctor, was very involved in getting the Flying Doctors program started. How can people in any community that is in need of healthcare, how can you reach out to those leaders to make sure that they're doing their part and getting that money from private hospitals or doing the outreach to the community about getting the health care you need or providing those services?
So one of the first things that Dr. Raul Ruiz did when he was still just a medical staff, he was an ER doctor at one of the local hospitals. This was way before he decided to run. He worked with an organization that put out a survey to a lot of the folks in the Coachella Valley. So the Coachella Valley consists of, I think it's 8 cities. And so they put out a survey to see what the need was, to see what was being offered. And from that survey is what they decided, is how they kind of put together a plan to see what was going to work. At that time, the California Endowment was putting together the Building Healthy Communities, and so they applied for the grant and they got one of those. So the Coachella Valley is a Building Healthy Communities hub. So they really leveraged the resources, and they brought that, I think with the California endowment funding coming in, it brought more folks to the table. So it wasn't just one organization doing this in a silo by themselves. They brought everybody to the table and said, okay, this is what we're doing. What piece can you take, and can we do things that doesn't duplicate our efforts but leverages the resources that we're receiving to reach more families? And so that's what they did. And Dr. Raul, well, now Congressman Raul Ruiz was a big part of that. And because of, I think, him having gone through that process in the community, that's when he realized that he needed to take his talents to a larger playing field. And that's really when he decided to run for Congress, because he saw that there was a big need, bigger than he even imagined. And that's when he decided to go from just being an ER doctor to being an elected official.
Awesome. And I think something else that Chelsea also mentioned was the need or the lack of understanding of people who have purchased insurance but don't necessarily understand how to access that health insurance benefits, or how to reach how to navigate the system. How do you understand what you purchased? Like, here we are, California with success, one of those states with the majority of people who signed up for to purchase insurance for the exchange. How can we, what models of getting out the information and explaining and educating to the community? Now you bought this is how you use it, or this is what you bought. Cindy, how would you suggest that we explain to young kids, this is what health insurance is, this is how this is how you make an appointment, this is how much you pay? What do you think are some strategies?
Oh, so maybe having like not exactly a class, but like maybe once a week or something, maybe like a class, or have at least a teacher go over it, or maybe like a big assembly, or some kind of like rally orientation that will make it fun for the students to actually come, or make it actually mandatory, because students should know this and they should be aware of this. And if we could have the school help as much as possible, and I'm sure they will because it's for the students' benefits, teachers should have like at least once a week have them have a lesson on this, on how all of this works, the medical insurance, and more aware about these medical reforms and such. So,
do any of your teachers actually, since you're still in school, have any of your teachers ever brought this up in one of your classes, or talked to you guys about it, or even tried to make you aware of it?
Yeah, I have my history teacher. He actually did try suggesting this at the board, and it didn't really go through, but he really wanted us to go ahead and like fight for what we should be learning. And this teacher, Mr. Johnson, he really does think that we should be more aware of like the aware of like about like the healthcare, like and this was at the time before the Hope Youth program, so I wasn't really like understanding what he meant, but now I do understand what he means. And he actually did want to start a club of just like advocacy, and definitely we'll go talk to him about that now. But yeah, he has mentioned it, the teacher.
It's a great suggestion, thank you, and it's duly noted here. Whatever excites you, whether it's a rally or reviewing info, I don't think healthcare is probably the most exciting, but it is important, and it is important because you guys need to help your family. Sometimes your parents don't understand that, so maybe giving this kind of education to youth will help their families.
Yeah.
Melina, would you like to answer that question? How do you think that we can outreach not just necessarily to youth, but to communities like in the Coachella Valley or in Bakersfield about educating them on what they've purchased? Because we're coming up on another enrollment period, but what useful is it to get all these people insured if they don't exactly understand what to do with what they purchase?
Well, I think with the World Cup going on, there should have been a lot of commercials about this. I mean, the audience for these big soccer events are huge, and a lot of the Latinos are watching these games. I mean, it could be in the middle of the night and people are watching, and so I think we need to really look at who we're marketing and how we're marketing. So instead of thinking that students or families are going to come to us for information, whoever it be, we need to figure out how to get to their market. So we need to make it cool. And if it means that we need to go into school, organizations need to go into schools and really give information on these are things you can do that are preventative care. I think there's a whole culture that doesn't understand preventative care. Going to the doctor once a year to get a physical and doing blood work is going to be so much more helpful in the long run than you go to the doctor because you feel sick. I think that's the culture that we've grown up is you go to the doctor when something's not feeling right or something's not good. And in our communities, that's usually too late. And that's when folks are getting diagnosed with some of these late-stage cancers that could have been prevented. So I think we need to really look at how we're marketing preventative care and really making that cool and something that we talk about. And hey, I know in my own family with all of this that's come out, we've been sending text messages at groups saying, hey, when's the last time you got a physical? Hey, when's the last time you got your blood work done? And it really puts the pressure on folks to have to respond. And I sent a message like that, a text message, and my mom said, I just went last week. Okay, good. How about, Uncle Herman? And how about Auntie Alma? And so they all responded, oh, I have an appointment. And I think we need to have conversations about these things around our kitchen tables and our family gatherings. And it can't just be something that's left to the medical professionals. It needs to be more of a comadre conversation that happens when folks just get together and asking folks, hey, so when's the last time you went to the doctor? So when's the last time you got your vision checked? So I think that's probably a big piece.
That's correct. Chelsea, you wanna chime in?
Yeah, I agree with Melina 100%. I think that those kinds of conversations are best sold amongst family members and friends and comadres. And I also think that her point when she's discussing that we need to make sure that we're going to them is integral. It's what's best for our community and what's best for our people as a whole. And when I say that, I just mean all of the people within our community. It does us no good if we're not reaching out to them, and then they're not showing up to the hospital until something is, very late in the game. They're in stage 3 or stage 4 of cancer when it's something that could have easily been preventable had they been going in each year and getting checked. So any way that you slice this is really the best thing, not only for the right thing to do, morally, make sure that these people are healthy, but also make sure they get the information. But from a financial standpoint, when you're looking at a financial standpoint and ensuring that they understand what preventative care is for, and they're able to access it, and they know how to use their insurance that they're paying for each month, financially, it's just the best decision to make.
Absolutely. So ladies, I want to thank you first and foremost for your time, and I know that we're in good hands. I've had the fortune of working with all of you and meeting with you, and you guys are amazing leaders in your community. And Melina, I think you hit the nail on the head when you said it's up to us to start those dialogues. It's up to us to start making sure that our community is informed, that our families are informed, that each other are informed. And it starts just with that simple conversation. So, like I said, Melina, I think you hit the nail on the head, and I think that's what our Leadership Institute and our youth are all about and what they're doing. So, thank you for that. And so, Cindy, Melina, Chelsea, I just want to see if you guys have any last-minute words or anything that you can think of that we should be sharing with our viewers today. So, take a second. Anybody last-minute words?
I think that we really need to start those conversations, and we can be the starters of those conversations. And if we don't know what the answers are, we can ask. And even just by asking, that encourages other folks to ask and to be more open about things. So I think we just need to start a conversation whatever way we can, in whatever way we can with whoever we can. And hopefully that'll start a wildfire that will spread, because we know that if we have some good gossip, it'll spread. So we can use that. We can use that talent that we have and use that to do something good for our community.
Absolutely. Chelsea, did you have something to say?
Yeah, this is Chelsea, and I love that point. I'm excited that that we've come this far already. I'm excited that the conversation is to get more people involved and help them use it, as opposed to them not having access to something. So, well, except for the undocumented, which we definitely need to continue to work on it from my perspective, but I'm excited that there's so many young people wanting to understand. Maybe they don't understand today, but they're able to ask a question, or there's information that they can find, and we need to help them navigate through it. But I'm looking forward to what's to come, because so far I think we've accomplished a lot of things, and I think that's great.
Cindy, any last minute words you want to say?
Yeah, so like there's like as a teenager at school, there's a lot of misinformation about healthcare, and so it's definitely really important that we have that we reach out to like the communities about healthcare, because a lot of them don't understand what Obamacare is, and we have teachers kind of they put Obamacare as a bad thing. We have other teachers that put Obamacare as a good thing. So a lot of students are confused, and or they don't even know about our health clinic. So there is a lot of misinformation, and we should seek out to the communities.
But I think you're doing a great thing, Cindy, in informing your colleagues about what you do know. Because at least, like, Melina and Chelsea said, it's going to get that conversation rolling. So with this, ladies, thank you so much for giving us your time. We have recorded this Google chat. We're going to make sure that it gets out, because it all starts with information. It all starts with talking. And that's what we did here with some amazing leaders. So thank you.
Thank you.
Thank you, ladies.
Thank you.